This is Dr. Steve Horwitz, and we are going to talk about exercise readiness for men over 50. You're going to start an exercise program. What do? How do you prepare? Lots of exercise advice thrown around the internet, thrown around the Twitter sphere. Much of it is wrong and frankly quite dangerous. So you really want to be prepared to exercise. So here's a very important form. It's called Physical Activity Readiness Questionnaire, or the Get Active Questionnaire. Prepare to become more active. Very important. Number one, have you experienced any of the following within the past 6 months? A diagnosis of treatment for heart disease, stroke, pain or discomfort, pressure in your chest during activities of daily living or during physical activity? Yes or no? A diagnosis of treatment for high blood pressure, hypertension, resting blood pressure of 160/90 or higher, dizziness or lightheadedness during physical activity, shortness of breath at rest, loss of consciousness or fainting for any reason. Have you had a concussion? Do you currently have pain or swelling in any part of your body, such as that from a prior injury, an acute flare-up of arthritis, back pain, something that affects your ability to be physically active? Has a healthcare provider told you should avoid or modify certain types of physical activity? Do you have any other medical or physical condition, diabetes, cancer, osteoporosis, asthma, spinal cord injury, that may affect your ability to be physically active? Answer these questions. Assess your current physical activity during a typical week. On how many days do you currently do any physical activity? What does it look like? Fill out this form. The link is in the info section below. This is very, very important. Also, we must say, check with your doctor first. And if you have a health condition, fill out this form. Do you have asthma? Do you have heart disease, hypertension, osteoarthritis, osteoporosis, type 2 diabetes? Please do not start an exercise program without going through this first. Let's move on to a physical assessment. Your assessment starts with your posture. Take an image of yourself from the front and from the side. From the front, is your head tilted? Do your shoulders look in alignment? Your hips, your knees, your feet? From the side, a line down the middle from your ear, your shoulder, your hips, your knees, and your feet. Again, the things look completely out of alignment. If your posture is not good and you load your system, meaning add resistance, and that includes aerobic exercise like even walking or running, if you add a load to the system and your posture's out of whack, you're going to have problems. This is extremely important. In addition, this will lead into a discussion of ergonomics, how you're sitting at your workplace, how you're sitting at home, what do you look like when you're sleeping? All of these things are extremely important going forward into an exercise program. So here's your physical assessment. Thank you to my beautiful wife, Sam, for being the model. First, we're going to look at your neck. So you're going to keep your mouth closed, put your tongue behind your top teeth, and bend and see if you can touch your chin to your chest. Chin to chest, and then go backwards. Can you get your head all the way back? Excellent. Now look straight. Now, can you turn to the right and touch your chin to the collarbone? And the other collarbone. And now look straight, and can you turn and rotate your head all the way to the side to the right, all the way to the side to the left? You should be able to do all these. Now, shoulder. Face away from me, please. And put your, let's do this with the right hand. Put your right hand behind your back and touch your shoulder blade from the top. Good. And now we're going to do touch your shoulder blade, opposite shoulder blade from the bottom. You should be able to do both of those. Now, we're going to go straight ahead facing the steps. And can you raise both arms straight up in the air? Straight up in the air. Yep, thumbs back, straight up. Excellent. Now we're going to continue with the elbows. So can you make a muscle, bend the arms all the way to the shoulder, and can you straighten all the way out? Very important to assess your wrists. So if you can, get down on all fours, put weight on your hands. Does this hurt your wrists? Now rock forwards, backwards, to the side right, to the side left. Does this hurt? Very important evaluation prior to starting a strength training routine.